Hello, my name is Dr. Sarah Walker, and I'm honored to serve as the 2025 President of the El Paso County Medical Society. On behalf of our organization, I want to welcome you and thank you for tuning in to the El Paso Physician. For the past 28 years, the El Paso Physician has been dedicated to serving our community, and we are grateful for the continued opportunity to bring this program to you on PBS El Paso. This would not be possible without the generous support of our community sponsors who help us produce valuable content every month. If you or someone you know is interested in supporting this program, more information is available at 915-533-0940 or at epmedsoc@aol.com. Thank you again, and we hope you enjoy this program presented by the El Paso County Medical Society and hosted by Kathrin Berg.
The RotaCare Medical Clinic is a nonprofit medical clinic dedicated to providing free, high-quality healthcare and health education to any member of the community, while at the same time training future generations of healthcare providers. They provide in-house primary care, lab work, and access to specialists. There's also a social worker on hand all the time. During the next hour, we have a part of the medical team of the RotaCare Clinic introducing what they do every single week. This evening's program is underwritten by Dr. Richard McCallum, and we also want to thank the El Paso County Medical Society for providing this program to you. I'm Kathrin Berg, and this is the El Paso Physician.
Neither the El Paso County Medical Society, its members, nor PBS El Paso shall be responsible for the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
Thanks again for joining us. Tonight we're going to be talking about the RotaCare El Paso Medical Clinic. Rotary El Paso started that several years back, and we have two founding members of that clinic here and two people who know where the bones are buried. So this is going to be a lot of fun that we're going to be talking about this evening. Dr. Richard McCallum is the medical director of the RotaCare Clinic, but he is also professor of Texas Tech and also the founding chair of internal medicine at Texas Tech from 2009.
That's right.
Thank you so much for being here. And I remember when, my goodness, I'm in the Rotary Club that put together this clinic, and I remember how much work and how much enthusiasm you had with putting all this together. Thank you so much for being here. We also have Betty Gallegos, who is the acting nurse manager, and it's from day one. Do I remember that right, or am I saying that wrong? From day one as well. And again, RotaCare opened up September 13th of 2014, and I can't remember a time that you weren't hanging around. I know you retired for 5 minutes, sort of, stayed on the board and then came back, so thank you for that. We also have Fabiola Ramirez here, who is the medical student lead currently. Also, you are in your last year of residency, so we hope that you come back as like a real doc. And you also, for a while, were the intern nurse manager at RotaCare, so thank you for being here. And then we have the H-less John Pierson. So John Pierson, that's Jon at Pierson, and he is the assistant medical director, and he's a graduate of the Paulo Foster Texas Tech School of Medicine. So thank you so much for being here. And I love speaking about the clinic this evening because it is the one place that people in our community can go where they do not get charged. And stuff that has to be charged, like imaging and specialties, there is a person on board, a social worker, that helps find the affordableness of that of whoever is coming. So I cannot thank you enough for doing this. What I'd like to do, Dr. McCallum, just because you're the beginning of everything, what and how can you describe, other than the opening here, of what the RotaCare Clinic is, and why do we have it here in El Paso?
Well, you've all done your homework as usual, Kathrin. You're pretty much up to speed, but let me give you the short answer. So when I came here in 2009 as the founding chair at Texas Tech University Health Sciences Center, with Dr. De La Rosa was the dean, we were approached by Rotary, the downtown Rotary Club, who were in a competition mode. They had projects that each member was proposing to be funded. And their model, called RotaCare, which comes from a clinic model in San Francisco, Bay Area, and in Seattle, where they did see patients in a voluntary mode, but did not have medical students, and was actually manned by physicians who were paid. So eventually, the RotaCare Clinic nomination, if you like, won the prize. And so I was approached by the head of Rotary at that time to consider coming down to the RotaCare Clinic and bringing medical students. That was new. Teaching medical students was not part of the blueprint that had been previously done around the country. So it really is now as it was then. We're looking after poor patients with no money, no insurance, and usually in poor shape regarding their medical status, and at the same time, a chance to bring first and second year medical students for the first time in their lives. They've just got the white coat ceremony. They've just been anointed. All of a sudden, they're sitting in a clinic with a patient for the first time in their lives. We give them 15 or 20 minutes to sum up the situation. And then the attending supervising physicians like Dr. Pierson and I and others come in, go over the case, examine the patient, elicit any new findings, and discuss the care and management. So we're training the future physicians in this country, including Fabiola, who was a first-class graduate. And we're at the same time treating the poor patients in this county, in this city. And we're doing what we went into medicine for. You know, we took the Hippocratic Oath way back in some cases to help patients. And this is a reminder to our students, this is your future, helping patients. You're starting here in really basic bread and butter stuff in the free clinic in El Paso, where patients have not had medical care and have no money. So that in a sort of summary form is how we all got started. But it's evolved from there, and I'm sure Dr. Pierson and others will elaborate on how much better, of course, it's become.
And this is, I think, a great transition for Fabiola for a moment, because I have to say that there's not been many times when we get to have medical students on this program. And when we do, you guys always blow me away. I remember we were doing the Texas Tech Willed Body program, and the main person on was a student and talked to us about the respect that is given to the person who is on the table who willed their body to science. And a couple of other times we had a student here, and there's just so much heart. And I think with the Texas Tech Paul L. Foster School of Medicine, I feel that is, and I think we've talked about this, that is actually part of the curriculum. Part of the social work that we're going to speak about in a little bit, part of the curriculum is not just the medicine. It is treating the entire person and sometimes a person's families that are with that. So my question to you, Fabiola, is when did you start hanging out at the RotaCare Clinic, which then led you to be the lead student, et cetera?
Yeah, so I started volunteering as a second-year medical student. Oh, okay. And as Dr. McCallum mentioned, as first and second-year medical students, we don't get a lot of clinical exposure. That all starts maybe third and fourth year. So that is a very unique opportunity. And I was just eager to get involved with the community and to have that one-to-one interaction with patients. But for me, the opportunity to volunteer at RotaCare has been so meaningful. It's been a crucial part of my education. And not only, like I said, do we get to volunteer as first and second year medical students, we also learn about the community. We learn to appreciate the patient's cultural background. And we learn to practice in a resource-limited setting. So that eventually helps.
Say that again, because we're going to talk a lot about that this evening. You're in a resource-limited setting.
Yes.
So expand on that. So talk about your limited resources.
Right. So because we depend on donations, we do everything we can to help our patients so that they don't have to pay anything out of pocket. So that includes paying for labs. Even though we get those labs at a reduced rate, it's still a cost to us, to the clinic. We do everything possible to have a social worker at all times, which is great. She's available to our patients every Saturday. And so that all comes with a cost. And so at the same time, when you're practicing in a hospital setting, you're used to ordering stuff without thinking about the repercussions financially to the patient. At the clinic, we stop to think a second and we say, okay, how much is this medication going to cost my patient? How much is this imaging, this x-ray will cost our patient? So just taking that moment to think about the cost to the patient helps us think critically, and I feel become better physicians, right? So it's a very unique opportunity, and I'm just very grateful that I had that opportunity. And of course, as the years progressed, I became more and more involved, and then eventually became the student liaison.
And Dr. Pierson said before we started, and sometimes I like using our conversation prior to us going on air, is like, she just needs to come back. So when you do your last year and you do everything you need to do, come back.
Oh, absolutely.
Because obviously I can see that the patients really like it too. And Betty, when you guys are at the door, you guys are in love with each other. I love that. So Betty, I think this is a great time to bring you in too. I don't know RotaCare without you. And so, again, in year 16, 17, I was the president of that particular downtown Rotary Club. And the contest you're talking about, Dr. McCallum, we were having our centennial. Right. We had to find a huge centennial project because that Rotary Club was turning 100 years old. And we needed to make a splash. And so there are other RotaCare clinics around the country. And this is what really solidified why we want to do this. We have a medical school here. Again, medical school now, 10 years later, is a lot different than it was in 2014 when it opened up. So there's everything in the right place at the right time. And then there's Betty. You see Betty, you hear Betty, you go down and you volunteer, you bring donuts, and there's Betty. And she's just like you did earlier today. And if you guys were here, it was great. I said, hey, look over my papers, make sure I have everything right. And very quietly, Betty gets up, takes my pen. Hold on, let me find, crosses this out, this is wrong, do this. It's just, I love everything about you because you do not let anything go that isn't right. On that note, when we were putting together RotaCare Clinic, it was going to be a 501c3, which means a nonprofit. It is something that there's no desire ever to make a profit. And the hard thing too is there's the application process for grants. If you're a 501c3, you can now apply for federal grants, state grants, private foundations, etc. How was that process thought about in the very beginning, or was that a model of other RotaCare clinics in the country? Do you remember at that time?
Well, I was like the last person on board.
No, you weren't.
So I was.
No, you probably were.
I was hired. I was hired in August, and we opened in September. So I was not really around with the planning.
Okay.
But since then, I have learned that yes, other RotaCare entities in the Bay Area. There are 10 clinics in the Bay Area.
Okay.
And their executive director, yes, they do apply for grants. They do have donations from different Rotary clubs in that area. I don't know if they apply for federal grants. We have not.
Okay.
We have applied for private grants and have gotten some, but primarily our operating expenses are from donations from the community, from Rotary clubs, from people on the board, from people who hear about us. There was a lady, I don't remember the name, who sent, she and her husband, I believe, was a Rotarian, and for almost a full year, they sent $100 a month to the clinic that I would get from the mailbox and I would take to our treasurer. Here you go. So
I'm gonna, you know what I'm gonna add right now since you're saying that, and it was actually a note on this piece of paper. I'm gonna tell you all what the address is, just in case you have a checkbook by you. And we never do this. This is not what we do, but this is a very special cause. But again, the RotaCare Clinic is at 301 South Schutz, and that's spelled SCHUTZ. And the zip code is 79907. So again, RotaCare Clinic, 301 South Schutz, SCHUTZ, 79907. And just out of curiosity, you can wrote on there the El Paso Physician Show, and we'll just see if there's any, and it literally $20, $5, $100 here and there, it all makes a difference. And I think on here too, I read that it's $125 más y menos when a patient gets seen. Is that correct? Yeah. Okay, and see, Dr. Pierson, now I get to bring you into the fold.
All right.
You know, so going from there, so you are the assistant medical director, and going forward and trying to figure out how to ask this question without begging for money, but begging for money and trying to get as many patients seen per week, because you have people, you opened up at 8 in the morning, but you have people lining up starting at 5 a.m.
Yeah.
And so talk about that scenario, just of how everyone really wants to come in.
Okay. Yeah. So probably one of our biggest challenges right now, when we talk to our patients, is that sometimes there's a wait. We're first come, first serve. So, people start getting there really early. I typically get to the clinic about 7:30. We're supposed to open up at 8 and then start seeing patients about 8:30, 9 o'clock. But a lot of times we'll have patients that'll come in, they're coming just for lab reviews or something like that. And so we'll try to get them through pretty quick first thing in the morning. But our biggest challenge is, from the clinic standpoint, is sometimes there's a little bit of a wait. Okay. We've explored being open on an additional day. So we're open every Saturday. We have explored, and so for the last month we were open on a Wednesday evening as well. And we saw about 30 patients in 2 days on Wednesdays. So patients get there early, first come, first serve. We don't turn anybody away. We try to see anybody that's critical first. I mean, it's like any medical facility. Anybody that comes in with something really critical, we'll try to fast track them through. We're trying now to separate streams so that we can separate people that actually need an exam and people that don't need an exam, so we can try and alleviate that bottleneck.
Right.
But I want to add something also to the financing. I think one thing in which we're unique is not only are we a nonprofit organization, but for the most part, nobody gets paid. You can have a nonprofit organization in which all of the members of the organization get paid, they just don't make a profit. Within our organization, every doctor that we have is a volunteer. All of the students are volunteers. We have a few paid positions. The social worker, she does it for essentially free, but we do have a few things. So that's one of our costs, but that's one of the ways that we try to lower the cost. The primary expense that we have is the laboratory tests that we have, and some utilities. The church provides us with the building for essentially nothing. I think we pay $5 or $10 a year or something like that. So that's essentially free. So we're kind of the scrappy clinic.
The scrappy clinic with heart, though. My
Exactly.
Gosh. Yeah.
Yes.
And how we function is, primarily all of the salaries are free because everybody's volunteer. We get a lot of donations. So anybody that has medical equipment that we may need, they can call us or send us an email or something. We can always use that.
And I read too that everybody who is providing their work for free, they're volunteering, every single one of those people also gives money to the clinic. So even the medical students and the doctors who are working there for free are also giving money to the clinic. So
our board of directors has agreed that every member of the board will donate to the clinic in addition to the time that they donate to running the
very
clinic.
nice. And Betty, you had something, you were going to jump in and say something. If not, I may have seen this one on site.
It was the cost.
It was
on the cost of the building from the
That
church,
makes sense.
and he's absolutely right. I actually think it's $1. a year.
Yeah. And I will throw this out there too, because I know that there are several people in the club that I belong to in Rotary that did provide medical equipment that, either it was something that was a little bit older, but still in fantastic condition. I know that there were some medical beds that were provided. And in general, if there's anyone that has access to equipment, the nice thing about this program now is that it's access, and I say this in the beginning and the end of the show as well. KCOSTV.org has it. You can access it at any time. YouTube, you can access it anytime, and El Paso County Medical Society website, you can access it anytime. So if you guys want to send this program to someone, it could also be a calling card of saying, hey, this is what we're doing to, again, if you want to apply for a grant, or just if you're looking at private companies and or foundations, you can do that as well. So use this, and I think that's going to be a great calling card for this going through too. Dr. McCallum?
One thing I'd add, Kathrin, is the fact that we've evolved. And I've got this to remind myself I don't miss anyone, but we developed subspecialty. So when a patient comes with a problem, we are gastroenterologists, we're internists, we're dermatologists. We can't cover every base well, and we actually admit that. So we have some subspecialists in covering here. Ophthalmology, we're doing retinal screening, which is unique. Psychiatry, looking after the post-COVID depression world that's around us and other things that cause stress. She's taking care of that. I'm looking at gastroenterology. We have a dermatology colleague, thanks to Fabiola's connections. We do pap smears and GYN exams, orthopedics. We look at patients with, who's our orthopedic doctor?
Dr. Mansfield.
Dr. Mansfield, who covers the Chihuahuas and
UTEP.
and UTEP, infectious disease options, and more recently we've teamed up with MD Anderson to look at papillomavirus, which is a major cause of cervical cancer in women, and head and neck cancer in all people, particularly men. And in addition, we have timely vaccination drives and health fairs to try to reach out to our community. So we've tried to evolve and grow, but to do that, it does take support, and I think that's why Dr. Pierson and you have harped on the fact that we would like to make sure our audience understands how important it is to try to give us some support to sustain our work.
And I love that this is it's a clinic that is almost in a neighborhood, but it really is for everyone in this region. Right. And that's something I want to stress as well, that anywhere that you come from, you can be seen in this clinic, which is super important. And when you were talking about these specialties, I'd love to expand a little bit more on MD Anderson, and just sometimes it's nice for the audience to know how some of these partnerships come to being.
Yes.
So we have someone now, and there's an obvious, they should be screened for a certain type of cancer, or it's an obvious cancer diagnosis. And so then what? And maybe we can bring in the social worker, patient navigator, if you will, of what you do now. Somebody comes in your clinic, someone who's not been to any doctor yet regarding a cancer that they have. How did MD Anderson get involved, and how did that partnership start?
Well, they approached us.
Okay, nice.
They wanted to start vaccinating. I think it began at age 6, didn't it? Very young. They want to do young people.
9 to 26.
Yeah. And now it's growing into older patients. But they came to us, do you have a predictable volume? If we brought vaccines down, could you vaccinate? And so after negotiating in time, we made that marriage. And they've given us vaccines, and we're now trying to reach out to our community and notify them that they should bring their children in and themselves and get vaccinated.
And this is the HPV vaccine
Yes.
specifically? Okay. And then it kind of just goes from there.
Well, for that, for breast exams, we do use the Baptist Clinic. We don't have our own mammograms at our clinic. For colon cancer screening, we do fecal occult bloods in the stool at our clinic. If they're positive, we obviously move on to Texas Tech and get a discounted colonoscopy, which is, you just did Colon Cancer Awareness Month, so you're familiar with that. So, yes, we try to do prevention as well.
And when it has here mobile health screenings, is that what you were talking about with other mobile units? And does the mobile unit go to the clinic, or does that mobile unit go to different areas for different screenings? Or am I hearing that differently?
We don't have a mobile mammogram clinic.
Okay.
But I would have one more thing. So
Yeah.
I just met with the dental school people.
Oh, fabulous.
We are going
Okay.
to be having a dental school connection, where a student will come down and examine our patients and select some to go to the dental clinic up here at Texas Tech. That's a major development.
And I think, I don't know which show we talked about it on a gastro show, is that there's so many things that you can find in the oral cavity. And unless you have normal checkups, I had a polyp on my tonsil that needed to be removed, but who found it? The lady who was cleaning my teeth at my dentist's office, you know? So that is so important. I think some people don't realize what a dental checkup can do. There's a lot being checked. I know mine goes through my throat and my thyroid and everything else. So I always feel very, very checked over when I go to the dentist. I love everything about that. I would love to talk about, again, the social worker, because I think that clinics are a place that people go when they haven't gone to the doctor for the most part. And maybe Fabiola, you can throw yourself in this too, of how is it that a patient that has never gone to a doctor before, when they come into the clinic and this is their first time, like, I've got something wrong, what is usually that type of interaction? And I know you're one of the medical students. I know that we try to get medical students out there every Saturday and every weekend and sometimes on Wednesdays you were talking about, but kind of walk us through some of those conversations. Like, they see you for the first time, you see them for the first time, there's, you know, a little bit of awkwardness, hesitancy, now what? And walk us through some of that. And Betty, I'm gonna ask you the same thing.
Yeah, so thank you for that question. Our patients, when they walk in through the door, they come in with a variety of barriers to care. And so we at RotaCare, and I'm really proud to say this, as students, we become really good at highlighting or basically finding by talking to the patient what these barriers to care are, what we call social determinants of health are. And so we are able to not only find these barriers to care, but do something about them. And that's where the social worker comes in, right? So we make our patients feel very comfortable. We basically try to establish that connection early on. We don't only address their physical ailments, but like I said, we also take into account everything else that they bring in with them. And so that's where we make that connection with the social worker and eventually find ways to connect them with other community resources. So I think that the fact that we take the time to talk to the patient, whereas in a regular clinic, they might get 10, maybe 15 minutes with the physician. We take sometimes up to 30 minutes just talking to the patient about, again, not just their physical concerns, but also everything else going on in their lives. And I think that's very unique to the student clinic setting. And so our patients really like the type of care they get. So yeah,
That's right.
I can throw in a good example that just from, I guess it was, in the last couple of months. We had a patient that came in, hadn't been to see the doctor in years. So she came in, when a new patient comes in, we do a basic set of labs. We do all the standard screenings and things. And so
labs from the get-go is something that's almost automatic when they come in.
For the most, yeah.
So you can get a baseline
if somebody new
of
that
everything.
comes in, there's certain labs that will run, and
Okay.
and the standard labs is a function of their age and different things like that. But it's kind of high value labs that will kind of give us an indication of various things, whether or not they may have diabetes or high cholesterol or things like that. And so everybody gets kind of the standard labs, and then, based on their age and situation, there'll be certain screenings that we'll want to do. And so one of them that Dr. McCallum mentioned was the occult blood. So it's a fecal a FIT test. And so we had a patient that came in. She hadn't been in for a while, probably several years. So we did all the basic tests, and we also did a FIT on her. And then usually what we do with patients is we will call them if they want to come back and review the results, we can review them with them, or we can review them over the phone, or if there's something that is substantially concerning, then we will call them and have them come in. Okay. Gotcha. And so this patient had, was very concerning, and so her FIT came back positive. So that means that she needs to have a colonoscopy, and she had some other concerning lab tests that came in. And so she came back, the students, talked to her, and basically they said, okay, well, she declined. She didn't want to have a colonoscopy, right? So she left. And this is where our clinic is unique. And so the medical students, we have a telemedicine type thing where we actually call up patients and we talk to them over the phone. Yeah. And so the students called her up and were talking with her about what the problems were and whether she understood the lab tests and stuff. And And she said, yes, she did. She didn't want to get a colonoscopy. So they said, we would like you to come back and speak again with the doctor. And that was me at that time. So she came back in, and I went in and talked to her about her labs, and I expressed to her that we had some concern, and we discussed, the possibility of having colon cancer and treatment options and things like that. And she was just like, no, I really don't want to do it. So I was defeated. So I got Dr. McCallum involved because
I was going to say,
because I'm like, you need to at least speak with a GI expert, and he can talk to you. And it turns out that she didn't want to burden her family. And she didn't realize that she qualified for Medicare.
oh,
And so,
again, this is where that communication
right,
comes
and she
in,
wouldn't even talk
information.
with the social worker initially. But Dr. McCallum got in there and started talking to her and explaining things. And once this happened, then she's like, oh, this isn't going to cost my family thousands of dollars. And then, oh, okay, well then, yeah, I could be interested. And so Dr. McCallum and the social worker got together and got with Texas Tech and figured out what program she'd get in. We walked her through how to apply for Medicare and what that would take. And I don't know because it was recently, but she's now in the process of going forward to see whether or not this is something serious or whether or not it's something that's not so serious.
Dr. McCallum, this is your time to get on, the horse and say, this is the one cancer that is preventable if caught on time, right? And we did colonoscopy last month, fine. But I feel like it's always worth saying.
What's also worth emphasizing is, we're seeing patients diabetes for the first time, hypertension. We're trying to prevent serious complications. We're trying to prevent emergency room visits, reduce their healthcare costs, and carry out prevention right, on the front lines. We see endless amounts of diabetes, high blood pressure, high cholesterol, obesity. We try to institute programs to start to treat that. And we're trying to overcome dropping into ERs, which cost you a lot of money just to be seen. We're trying to help really identify problems early in these patients who've never been seen. They've never heard of diabetes. All of a sudden we find it, which is a life-saving.
And very advanced in many cases too, yeah.
And so that going back to that point of earlier, if they've never gone to the doctor, there's something that's bringing them to the clinic, which means they are feeling that something is wrong. But what I love about this too, just reading through this, is that there's a lot of prevention that's here. And my question is, and Dr. Pierson, you had a point, that this person that came in for labs had been there before, but it hadn't been 4, 5, 6 years. Right. And I don't expect a real number, but how many people are not regulars? That's the wrong word. I don't know what word I'm looking for, but kind of know to come like once every 2 years just to kind of get things checked out. Are there some that are kind of in the system?
Yeah.
That's okay.
Yeah, quite a few.
So
Yeah.
Betty, take it from there, because again, you've been there from the get-go.
From the get-go.
And this is, and I remember too, like starting to enter information was also, that was a lot of work too in the beginning to try to get that system to probably where it is now. And I feel like they're never perfect. But talk about that aspect.
Well, the
of
original original plan for the clinic was for patients to come in and be seen, and then for our social worker to be able to help them transition to a primary care physician. Well,
That's not super realistic.
that hasn't really worked
Yeah.
because
We do some of that.
We do some.
That's still our motivation.
That's
but-
true.
If we can get
But
it.
we have patients who come back and come back and come back because we provide this high quality care, and they love the students and the doctors that we have, the caring that we show to people in the clinic. And so they come back because they love us.
And to your point too, this, and what do we say, scrappy, but scrappy with heart?
Scrappy with heart,
I
yeah.
think the students, man, and part of it is El Paso. I just feel like, are you from El Paso?
I
Fabiola?
am proud El Pasoan.
I was hoping, man, she better be from El Paso. This is just going to go nowhere. But we have a heart here that I think many other places don't. And Dr. McCallum, going back to what you were saying, there wasn't really a medical student model in the other RotaCares around the country. This
We're
is
still the only
like
one.
the place to start. We're still the only one.
We're still the only RotaCare clinic that utilizes medical students. Yes.
What a waste for everybody else.
Also,
Yes,
the
Dr. McCallum.
bilingual nature is very important. Fabiola is a good example of that. Our medical students are immersed in Spanish before they start school for a couple of months. So they're down there in the clinic conversing with Hispanic patients very comfortably. And that makes, I think, the families feel better that we're trying to, meet them halfway and try to understand their problems. So I think the bilingual component, we have interpreters too. We have students from UTEP who are pre-med coming in and helping us do vital signs, register patients. And so we're providing the future new students who want to go to medical school. And we hear about them every year who have evolved from the UTEP student pool. But the bilingual nature is an asset.
Yeah, I bet it is.
Very much so.
So here's a question for people who are listening and watching that don't have any kind of a medical background, but they'd like to help. And let's say they don't have enough money to give. So I've heard you, I'm thinking intake, registration. It would be great to have a medical student there, but do you just need sometimes extra bodies with a heart, so to speak, that can help out on Saturdays? And I do want to expand a little bit more on, you talked a little bit about Wednesdays, and I want to expand on telehealth too. But in general, since we're here, can people help on Saturdays? Would it be best to call the clinic to find out if you would qualify, for lack of a better word?
So right now, the last year or so, we've been really lucky. We've been very successful in expanding the I guess scope of RotaCare within the student population. And so right now we have lots of students. We're doing great. Yeah, okay. We get lots of volunteers. So we've been very blessed in having people. Recently, we went through a phase a few years ago where we were short of physicians. Recently, we've had a number of physicians that have signed on, and are, usually physicians will agree to maybe one Saturday a month or something like that, or one Saturday every 2 months or something like that. And so we're doing pretty good right now with that. We're constantly looking for new people. Primarily, we need physicians, licensed physicians. We need to have at least one there to oversee the students. But in terms of people, we're doing pretty good. Okay. Now, this year we've gotten a lot more involved in doing health fairs. As Dr. McCallum mentioned, we're doing the vaccination drives. We did an influenza drive. We're doing the HPV drive, and we've done those in conjunction with some other organizations. So the Medical Reserve Corps has been involved in some of that, and so a lot of times when we do those, we can use people. It's usually a bigger event. Sometimes it's in our parking lot. Sometimes we go to other health fairs, and so sometimes we can use people.
And how do you throw the word out there for that? Because I'm trying to think too, it's like everything's so different. Like when we started, social media wasn't.
So we have social media now.
Yeah,
so we are on Facebook, we have Instagram, and we do at least, I think, 1 or 2 posts a week.
Excellent.
Typically we take some pictures around the clinic on Saturdays, and we post that anytime a special event. So our psychiatrist is expecting, and so we threw a baby shower at the clinic, and so we had some pictures of that we had posted on our website.
See, this is where the family element comes in. Oh my goodness.
The best way to describe this clinic is a family.
Yeah.
It really is. I was a student at Paul Foster. I actually volunteered a few times at the clinic when I was a student, and then I came back to give back and to be a part of it. For me, it was really just to be a part of it. I enjoyed it. As you mentioned, Dr. McCallum and Betty have been there since the beginning.
Well, I was just thinking too, when Betty walked in, we had, I can't even remember when that RotaCare Clinic gala was, but years and years ago.
I think the first one was in 2016, I think.
Well, there you go, 2016. So that's 9 years ago. And the second I looked at you, it's like, you look exactly the same. I'm thinking, yeah, I remember. And I guess I will say the name. So we had a student, Jake Wilson, in there. Micah Elowitz was there. So I'm just thinking, I'm just going back to all these students now. If they were at Fabiola, it would be in there. But if I saw them tomorrow, you're just like, hey, what's going on? It's just, it is so heartfelt. It's not even funny.
They keep up as well.
Oh, good.
Wilson's doing a GI fellowship in Charleston.
In Charleston,
Medical
that's
College
right. Okay.
of Charleston, and
I'll send him a link to the show.
Jerry Fan, met his future bride, Jennifer Nelson, at the clinic. He was courting her between patients. And then he went down to Texas A&M, and he's now a faculty cardiologist. And she's a...
Pediatrician, right?
yes.
Didn't she do peds? Yeah.
So, it's very nice to have the continuity, but also would mention the El Paso County Medical Society. The students who are leaders in the El Paso County Medical Society who go to Austin and go to First Day at the Capitol and those things, they're also in our clinic. And so we've had very nice support from Patsy Slaughter and her team in making sure our clinics are well publicized.
Yeah, I love that too. And we'll just do a shout out right now. The show's been running for 28 years under the El Paso County Medical Society.
Yes.
Absolutely amazing. And they're the ones that put it all together. Shout out to Patsy and Elsa out there. We're trying to not say anything. But Dr. Pierson, I would like to talk a little bit again. And I don't know if telemedicine really started or became a big thing during COVID. But I would think also because of, you talked about the lack of resources earlier, right? That there's not enough money to be open every day. And when there is a little bit of money, maybe there's a little bit of being open on Wednesdays. But for the most part, if someone really has an issue on Tuesday, would they have to wait till Saturday, or telehealth? Is there a phone number that they can call at this point? And I didn't ask about this ahead of time, and I should have. My apologies if I'm just throwing that out there and I shouldn't.
No, that's fine.
But how would that work?
So our telehealth probably doesn't fit under the technical definition of telehealth.
Okay.
But we call it that. But really, what it is more. It's most of it is like an outreach, and so it is us calling up patients and letting them know that we have some concern. A lot of times, it has to do with labs. We'll get, typically we get labs back a day or two after they come into the clinic, and if we have some concern over that, then we'll call them up. If it's something that can't wait till Saturday, we'll call them up and say, you need to go have this checked out. All right. And we'll talk to them over the phone if that's appropriate. Typically we will call them up, like sometimes we'll have somebody that will have, really high cholesterol. We had one recently that had insanely high cholesterol. And we just told them, we said, we screened him over the phone whether or not he was having any symptoms and things. And then we told them what to look out for, and then come in on Saturday. And so we do that. We actually follow up with patients over the phone. So a lot of times if we have a patient that we start on a new treatment for something, we'll call them up and say, how's that working for you? A lot of medications have side effects,
right.
And we'll talk to the patients about the side effects, but then we'll call them up usually a couple of days after that and say, how's that working? Were you able to get the medication? A lot of times, one thing we found was a lot of patients we had prescribed medications for, and they would go off and they wouldn't fill it. Sometimes it would be for a financial reason. Sometimes it would just be they're like, I feel healthy. I don't need this medication. And so we'll call them up and just check in and say, were you able to get your medication? How's it working? And then we'll ask them, how are you taking it? Because a lot of times people get confused over how they're supposed to take their medication. So that's mainly how we use our telehealth.
Right.
It's just calling up the patients. We try to we go through and review the charts, and we usually go back a couple of months and look at the charts and make sure. We'll have students that'll read through the notes, and if the note says we need to see this patient in 2 months, and then we look, it's been 2.5 months we haven't seen them. We'll call them up and we'll say the doctor wanted to see you back.
This is better than many, honestly, internists, and I should.
In a lot of regards, we are.
Not on anyone, but that is really a beautiful thing.
Yeah, in a lot of regards, we do. We and
Very
getting back to Fabiola's point, we have a challenge because of the finances, but it also, in a lot of cases, forces us to be better doctors because we have to make better decisions. When I worked in the hospital, you'll just order all the labs and sometimes that really confuses the situation. And in ours, we're back to like kind of old school where you let the symptoms drive, symptoms drive you in the direction that you want to go in. And you make better decisions on lab tests.
Right.
Because, sometimes you have a test that will tell you just a tiny bit of information and may cost $300 or $400. And so, so it challenges the physicians and it challenges the students to think through the tests, and it's like, is that test really critical for this decision?
Exactly. And to yourself better, Doctor.
And I
Dr.
can
Betty.
answer your question about a phone number.
Yes.
So when patients call in to our number, which is 915-790-0700, they leave a message. It comes to the computer that the nurse manager has.
Oh, nice.
And so then we look at those and answer those and call those patients back to see what is happening.
Okay.
And so if it were an emergency, then the nurse manager, we're not doctors, we're nurses, but we listen to what the patient says and when what their concern is, if it's something that could wait until Saturday. We explain a lot of times patients want to make an appointment. We don't make appointments, it's first come, first serve. But if it's something that's critical, you need to go to an urgent care or you need to go to an emergency room. This is something that you don't want to sit on.
And that's where the navigation comes in. I feel like that is so, and you were talking, Dr. Pierson, the proactiveness in this, right? The navigation when you don't really know what to do if this is a situation you've never faced before. And it's paralysis, right? There's analysis paralysis that's happening. But if there's someone calling you saying, this is what you need to do, this is where you need to go, this is how it's going to look, this is what they're probably going to ask, that part of it is so crucial. And that's why I was so impressed earlier when I was reading through this about the social worker that's there, that probably is a social worker on steroids. You can imagine just all these different directions that you're trying to put these people in.
And the social worker has the network to do it. They have the information.
They're from Texas Tech and
It is
UMC,
amazing.
so they know all the tricks. She knows all the tricks.
Nice.
Grace, our social worker.
Thank you, Grace.
Yeah.
Amen.
Yeah, amen. There you go.
I would put in, before we get too late, that, I tell the medical students every Saturday, this is why you went into medicine, to help patients. And one day when you're doing well and 30 years later, you'll think back where it all started. I got my white coat. I saw my first patients here in the RotaCare Clinic, and I saw patients who had bread and butter medical problems that were never diagnosed, and I started treating them, and I prevented a complication. I improved their life. And I think those memories and that commitment can't be overemphasized. It's a very, very important situation.
Agreed. That makes sense. But yes, Dr. Pierson?
And one of the interesting things, the way that our clinic works is, so the doctors that volunteer there, a lot of them are in subspecialties. And so one of the things that we've been doing is we do it's kind of called like an internal referral, right? So if patients come in and we see them and we determine that they really need to be seen by a specialist, maybe they have a rash, they need to see a dermatologist, but it's not, it's not an emergency situation. Then what we'll do is we put their name on a list, and then we organize that list so the next time that specialist comes in, we will call those patients up, and then they get priority seen by that physician, and then if we get through that list, then he'll see other patients.
And I'm going to go through that list again, which I love. So it's ophthalmology, psychiatry, gastroenterology, dermatology, OBGYN, orthopedics, and infectious disease. So that's what I have here now as the specialties, which covers a lot. Right. Yes. And so I think that's fantastic.
Right. And so we try to do that route first, and then, but if it's more critical, that's when we really get the social work involved, because we try to provide as much stuff as we possibly can for no cost to the patient. So if we do an internal referral, then that's not going to cost them any extra, unless they need to have imaging or something like that. But to actually see the specialist, if it's not an emergency, it's no cost to them. They get to see that specialist. Right. If it's something that we don't feel like an internal specialist could handle, or it's more time sensitive, then we explore sending them to Texas Tech, or in the worst case, we will refer them to the emergency department to get them seen.
Okay.
So.
Betty, I'm dying to ask you this question, because again, I feel like you are and have been on the front line since the beginning. I would just love to hear, again, scrappy with a heart, and I keep saying that, but I hope it doesn't stick, but I kind of love everything about it at the same time. But some of the stories, some of the case studies, without giving names or anything, is there a patient or two or 20 that sticks out in your head that you think, this is a case that we kind of followed, or this is someone that we saved their life? Do you have any good story? I know she's thinking, wow, okay, it's only been 10 years, geez.
Yeah. There are a couple that I can remember. I do remember a patient who had a very low hemoglobin. And labs came back. And I was notified. And I notified the medical director, who at that time was Dr. Espinosa. And he said, you need to contact this patient and she needs to go in and have a transfusion. So I call, no answer, wrong number, something. Later on, this was on a Sunday when I got the phone call. I called the police to go out for a welfare check. They didn't find her. 2 weeks later, she walks in to the clinic and says, I hear you were looking for me. I went, oh my goodness. Yes, you need to go. But I remember her. There's another patient that we had that there's a written letter on the wall in the conference room that he sent about how he appreciated the clinic and that we listened to him and helped him take care of the problems that he had. And I think this was one of the halfway house patients when we were seeing them.
Yeah.
And that it's just amazing.
Do you see, I know we're 10 years in at this point, actually 11 years in, and I know medical specifics are what we usually cover, but with the clinic, where do you all see and or hope this scenario 5 years from now? So the desire is having enough funding to maybe open twice a week, and then going from there. Maybe I saw somewhere, I don't know if it was in this paperwork, moving locations or adding locations. What's kind of in the future? Or is that too scary of a proposal to ask about?
Well, no, we are voluntary, we all have our jobs. So I think the expansion could be to a couple of days a week, one night and one Saturday. I think with electronic, connections now, we can probably try to connect with our patients on a more sort of communicative level and maybe do things without having to come into the clinic itself. We may be doing more sort of virtual contact. Increasing our subspecialties, I think attracting more students. We're the biggest clinic in the city, but I think we can take more students because it's a crucial part of their training is to see bread and butter medicine before it's really been diagnosed. But I think crucial to all that is what's sitting next to me also is a reminder to have our audience please think about helping us financially because, we volunteer hundreds of hours and we do need support to sustain our activities. There's no question about that.
And again, use this program, send this link to as many people as you can that you think might be able to help. And Fabiola, I feel like you're the young one in the group. So explain how that works for people, because we have a lot of medical students in our community. And sometimes we have no idea when we're shopping at, Vista Market or whatever. But you are going into your last year, your residency. What does that mean? And are you already picking your specialty when you're looking at the RotaCare Clinic? Has anything inspired you, like maybe I'm going to go through this discipline and that discipline? In general, give us your thoughts on that as a medical student.
Yeah, so I am a fourth-year medical student going on to residency. I've matched and I'm going into dermatology. And of course, my experience at RotaCare really inspired me. We are lacking dermatologists in the city. So we do see patients that come in with pretty significant skin conditions that haven't been diagnosed. They just haven't had access to a dermatologist in the past. And so that has inspired me. And I hope to one day return to El Paso after I finish my residency and volunteer at the clinic.
Wow.
I call it that my kids make fun of me. I have a lot of scoops taken out of me. I was a lifeguard for many years, and it's like a scoop out here, a stitch here, this and that and the other. So we definitely need that. Right now, how is it that medical students are being sought after? Is it done through the classes? You're a professor at Texas Tech. Is that something that you've got? Here's our name and number up there. How does that usually work?
We have a leadership transition in January each year, and Fabiola could fill us in again how that evolves.
Yeah, so the clinic is well known within the students. The volunteer spots are actually coveted spots because, again, we learn so much. So there is a list of students that want to volunteer. We send out an email every month, and basically first come, first serve. So whoever answers that email, we go through the list and we select those students in order to come to the clinic and volunteer. And then a yearly transition of leadership. So we go through the process of, there's an application process, and so we select a student leader, and then we also select, for example, a lab tech leader, somebody in the front desk to register patients. So we have a couple of leadership spots, but it's a once a year transition that we go through.
Very nice.
I have heard
Yes.
in the very beginning, before Dr. Pierson was talking about this, the lull that we had with students, but in the beginning and now, that if you don't answer that email within 5 to 10 minutes, you don't get a spot for that month.
It's done.
And that is so exciting.
I love that. That's great. I'm going to throw out the number once again for those of you that didn't catch it earlier in that area, or if there is an issue and you need to get a message to the clinic, that telephone number is 790-0700. And also, if you want to make a donation, I'm going to put Valeria and Emily on the spot here, that maybe there will be a QR code on here where you can put your phone up against the screen that you see to do a donation. And you can also send a check for a donation to 301 South Schutz Street, and that's SCHUTZ. The zip code is 79907. And if you want somebody else to see this program, or if you want to watch this program again, there are several places that you can do that. You can use this as a calling card. Again, anytime you want to say, hey, this is what they do, help them out. KCOSTV.org. You can go on there, and again, just look for the logo El Paso Physician. Also the El Paso County Medical Society, which is EPCMS.com. And then also youtube.com. And on any of those platforms, just type in the El Paso Physician. Specifically, this show is going to be called RotaCare Medical Clinic, or just think of RotaCare, RotaCare. But there's also, if you want to watch the colonoscopy show that we just did last month, or any ailment, I know Dr. Mansfield was mentioned earlier, we have orthopedic programs on that he's been a guest on. So any ailment that you're looking for, you can find at one of those platforms. Thank you so much for joining us. I'm Kathrin Berg, and this is the El Paso Physician.
The El Paso County Medical Society is a nonprofit organization established in 1898 that unites physicians to elevate the health of the El Paso community. We have been bringing the El Paso Physician television program to your home for the last 27 years on PBS El Paso. If you should have any medical questions relating to this program, you may email us at epmedsoc@aol.com, and we will try to have our experts answer your questions.